When you hear night terrors, you probably think of children screaming in their sleep, but here's the surprise: adults get them too. And for some, they're more intense, more dangerous, and far more common than people realize. This isn't just bad dreaming. This is the kind of fear that hijacks your body, bypasses your logic, and leaves you shaken long after you wake. Today, let's talk about night terrors in adults, what they are, why they happen, and why we don't talk about them enough. What exactly is a night terror? Night terrors, also called sleep terrors, are a type of parasomnia, abnormal behaviors during sleep. They're different from nightmares. Nightmares happen during REM sleep, and you usually remember them. Night terrors happen during deep non-REM sleep. You often don't remember them at all. During a night terror, you may sit up suddenly in bed, scream, cry, or talk incoherently, breathe heavily, sweat, or have a racing heart. Appear awake but be completely unaware of your surroundings. Resist being comforted. Get out of bed and even run or fight. And the next morning, you might have little or no memory, but your partner or roommate will never forget. Why do adults get night terrors? Night terrors in children often fade with age, but in adults, they're usually linked to underlying triggers, stress and anxiety. High emotional strain can spill into sleep. Sleep deprivation. Being overtired disrupts normal sleep cycles. Alcohol or substance use can alter brain activity during deep sleep, trauma or PTSD. Emotional memories can break through fever or illness, can disturb the nervous system's sleep regulation. Certain medications like antidepressants or sedatives, sleep disorders such as sleep apnea or restless leg syndrome. For adults, night terrors can be episodic or chronic, and they often point to something deeper that needs attention. How they affect daily life. Night terrors aren't just scary while they're happening. They can leave a lasting impact: sleep disruption, chronic fatigue, fear of sleeping, insomnia, relationship strain. Partners get startled or even injured during episodes, embarrassment, fear of others finding out, heightened anxiety or depression. For some, the emotional aftershock is as bad as the event itself. Why they're more dangerous in adults. Children may thrash or cry during night terrors, but adults are more physically capable, and that can be risky. Some may run into furniture or walls, fall downstairs, leave the house while half-conscious, lash out physically without realizing. That's why adult night terrors aren't just unsettling, they can be physically dangerous. What you can do about them: if you're dealing with night terrors, prioritize sleep hygiene, consistent sleep schedule, calm wind-down routine. Reduce stress before bed, breathing exercises, journaling, meditation. Limit alcohol and caffeine, especially in the evening. Treat underlying sleep disorders like apnea or insomnia. Seek professional help, especially if episodes are frequent, violent, or distressing. Create a safe sleep environment. Remove sharp objects, lock doors, secure stairs. In some cases, therapy, medication, or a sleep study may be recommended. When to see a doctor. You should seek medical advice if night terrors happen more than once a week. They cause injury to you or someone else. They interfere with your daily life. They appear alongside other sleep problems like gasping or choking at night. They began suddenly in adulthood with no clear cause. Night terrors in adults are often a symptom of something else, and addressing that root cause can make all the difference. Reassuring, empathetic tone. Night terrors can be frightening, not just for you, but for those around you. But they don't have to control your nights. If you experience them, it's not a sign you're crazy or broken. It's your brain telling you that something needs attention. And with the right care, you can reclaim your sleep and wake up feeling safe, rested, and in control.